Shoki, who's NHS? Say our NHS. Can you say our NHS?
People really know what they're doing. They know how to game the system and how to fool people. How are they doing it in the UK?
Well, they've basically bought our politicians. They certainly dominate the media narrative. Most of the public, indeed most of the professionals who work in our health system, haven't got a clue, and that's the purpose of our film. It's a real desperate wake-up call.
And United Healthcare, this is the company that Stephen J. Hemsley is the CEO of, who has taken over $1 billion in compensation. His predecessor, who is referred to as Dollar Bill McGuire, took over $1.6 billion of compensation. Got busted for fraud, had to give back a couple $100 million.
Hospitals now are built on PFI deals, and the profits from these PFI deals very often are siphoned off into tax havens. So not only are we paying through the nose and paying 20, 25 years down the line, sometimes 5 times the original cost of those deals, the taxes aren't even being paid on the profits very often.
PFI has transformed our hospitals into away from actually caring for people and into a means of making profit from the public sector. They've been a key means of privatising the NHS, but the scandal is hardly talked about either by the media or politicians.
Right, okay, you're at that one. I'm at the third one over. I'm behind Winston Churchill. Wait.
I think the solution has to lie with everybody doing something rather than waiting for fake leaders. One thing I have learned is a lot of the campaigning groups are not holding back from achieving goals by accident. The BMA is a good example. It wasn't mismanaged, it was deliberate. It was designed to fail, to sap the morale of the staff. They went from the odd day strike to a 5-day strike. People didn't have the appetite for that. They knew that. They created confusion, and now they've dissipated a lot of the fight back. But other campaign groups, I know I was involved in the Lewisham campaign. At its peak, it refused to talk about the national picture. There were 2 key meetings where the local Labour Council came in, and it was a pack and stack operation where the campaign was shut down, and people like me who had never seen this sort of thing before walked away in disgust. And this has happened time and time again. I'm sure you're aware of the concept of controlled opposition. It's because lots of the organisations are nobbled at the top, plenty of good people down the bottom who don't quite see they're being misled. You know, I had hoped that Corbyn would do the right thing, but why is he or his health secretary or McDonald not telling the public what I'm telling you? They know. They were part of it. They know Simon Stevens is coming from United Health. They know the structural changes are set up for an insurance system. I didn't hear private insurance take over today, did you? No. Why are they not doing it? How long do we give them until it's all done and dusted? So we can't wait for leaders, we've got to do it ourselves. It's only later on in life that I realised how much of a privilege it was to deal with patients without money contaminating the system.
Absolutely.
We're reasonably paid, yeah? It was such a delight to genuinely tell my patient in front of me, look, this is what I think's wrong with you, and this is what I think we should do. That is going. Now I have to think what my CCG wants me to do, yeah? What incentive am I going to get for doing this, that and the other? It's completely perverted my relationship. And I realised that I was being dragged into this corruption by labelling elderly people at home unscheduled care, okay? They don't deserve to go into hospital. They need to die at home, basically. This is what we were being softened up to believe. That why has this person with predictable chronic diseases become ill? You should have managed them better. And anyway, care is better at home, all right? This is extremely toxic. And I ended up knowing that I am reluctant to admit this person because I've been brainwashed by my CCG that maybe I should have managed it differently at home. Maybe I'll take an extra chance, okay? And then I had to wake up, right? I was being sucked in to all of this nonsense. And I said, I'm not going down that road. And I said to my wife, look, it might mean our source of income goes, but the way this is going, if I don't speak out, I'm not going to be working in that new system anyway. I can't do it. I'd rather go down fighting than with my tail between my legs. Fortunately, nobody's come for me yet.
We'll look after you, Bob.
We'll look after you. All right. And that's what I'm fighting for, is to restore that clean relationship with the patient. And it's been a privilege for me, and I want it to be a privilege for the young doctors who are now saddled with a bloody £100,000 debt, who don't know what privilege it has been to work in a system where you don't look at the patient's wallet or start to judge them for living too long, drinking too much, being overweight, whatever. I don't want to judge my patient. I don't want to demonize my patient. Neither do I want my relationship toxified with one perverse incentive or the other. Thank you.